Have you ever wondered why measuring health is crucial? It's like baking a cake without a recipe. You're just throwing ingredients together hoping for the best. We need measurements in healthcare to understand what's working, what's not, and where we need to focus our efforts. Just like a doctor uses a thermometer to check your temperature, public health relies on data to gauge a community's well-being. By measuring health, we gain valuable insights into the factors impacting our communities. It helps us identify trends, disparities, and areas for improvement. For example, tracking the prevalence of certain diseases can help us understand risk factors and develop targeted interventions. Ultimately, measuring health is about making informed decisions that lead to a healthier society. Imagine a community where everyone has access to quality healthcare, where chronic diseases are prevented, and where people live longer, healthier lives. By understanding the importance of health measurement, we can work towards creating a healthier future for all. Hey everyone, it's Dr. Mike, and today we're talking about a topic that's close to my heart: measuring health. Now you might be wondering, why is measuring health so important? Well, imagine you're trying to solve a problem in your own life, like improving your sleep. The first thing you might do is track how many hours you're actually sleeping, right? It's the same thing with public health. We need to collect data to understand the health challenges our communities are facing. This data can include things like rates of chronic diseases, access to healthcare services, or even factors like air quality and access to healthy food. By collecting this information, we can start to identify the most pressing health issues in a particular community. It's like putting together a puzzle. Each piece of data helps us see the bigger picture. For example, if we see a high rate of obesity in a certain area, we know we need to focus on things like promoting healthy eating and exercise. And it's not just about collecting data, it's about analyzing it too. We need to look for patterns and trends to understand why certain health issues are more prevalent in some areas than others. This helps us develop targeted interventions that are more likely to be effective. Let's say we're looking at data on heart disease. We might find that certain neighborhoods have higher rates of heart attacks. By digging deeper, we might discover that these neighborhoods also have higher rates of smoking or limited access to healthy food options. Armed with this knowledge, we can start to address the root causes of heart disease in those communities. Maybe we partner with local organizations to offer smoking cessation programs, or work with grocery stores to increase access to fresh produce. The point is, measuring health allows us to move beyond assumptions and make decisions based on evidence. It's about being strategic with our resources and ensuring that our efforts are actually making a difference. Because at the end of the day, we all want to live in healthier communities, and that starts with understanding the challenges we're facing. So let's get out there, collect that data, and use it to make our communities healthier places to live. Let's talk about planning. You wouldn't build a house without a blueprint, right? It's the same with improving community health. We need a plan, and a good plan is always grounded in data. That's where baseline data comes in. Think of baseline data as your starting point. It tells you where you are right now, so you can set realistic goals and track your progress. Let's say we want to reduce smoking rates among teenagers. The first step is to find out how many teenagers are currently smoking. That's our baseline. Once we have that number, we can start developing strategies to bring it down. Maybe we implement an anti-smoking campaign in schools or work to restrict access to cigarettes. But here's the key. We need to keep measuring throughout the process. Regular monitoring allows us to see if our strategies are working. Are smoking rates going down? Are we reaching our target audience? If not, we can adjust our approach along the way. It's all about being flexible and responsive to the data. Imagine you're training for a marathon. You wouldn't just run blindly without tracking your mileage or pace, would you? You'd use that information to adjust your training plan and make sure you're on track to meet your goal. It's the same with public health. Data helps us stay on course, identify what's working, and make necessary adjustments along the way. It's about being efficient with our resources and ensuring that our efforts are actually making a difference. And the best part is, when we use data to drive our planning, we're more likely to see positive results. We can demonstrate the impact of our programs and make a stronger case for continued funding. So whether we're talking about reducing smoking rates, increasing vaccination coverage, or improving access to healthy food, remember that planning is key. And the foundation of any good plan is solid baseline data. In a perfect world, resources for health promotion would be unlimited. But the reality is, we're always competing for funding and support. That's why it's more important than ever to demonstrate the value of what we do. And how do we do that? You guessed it, data. Data is our most powerful tool when it comes to justifying resources for health promotion. Think of it like this. You're going to a bank for a loan. They're not just going to give you money because you have a good feeling about it, right? They're going to want to see your business plan, your credit score, your track record. They need evidence that you're a good investment. It's the same with securing funding for health initiatives. Funders want to see that our programs are effective, that they're making a real difference in people's lives, and the best way to show them that is through data. Let's say we've implemented a program to promote physical activity in a community. We can collect data on things like the number of people participating, changes in physical activity levels, and even healthcare cost savings due to increased activity. These numbers tell a compelling story. They demonstrate the impact of our program and provide concrete evidence that it's worth investing in. We can go to funders and say, look, we've reduced healthcare costs by X amount, or we've increased physical activity rates by Y%. This data-driven approach is essential for securing funding, but it's also about accountability. When we track our progress and measure our outcomes, we're demonstrating that we're responsible stewards of the resources entrusted to us. And it's not just about money. Data can also help us garner support from policymakers, community leaders, and even the general public. When we can present clear evidence that our programs are working, it's much easier to rally support and create lasting change. We all know that health promotion is crucial, but it often gets overshadowed by other areas of healthcare. One way to change that is to elevate the entire profession, and data is the key. By showcasing the impact of our work through rigorous measurement, we can gain recognition, attract more talent, and ultimately have a greater impact on population health. Imagine a future where health promotion professionals are seen as essential as doctors and nurses, where their expertise is sought after and their recommendations are taken seriously. That's the kind of future we can create by embracing data. When we consistently demonstrate the value of health promotion through data, we earn credibility. We show that our work is not just about feel-good initiatives, but about evidence-based strategies that produce tangible results. This shift in perception can lead to greater investment in research, training, and professional development for health promoters. Think about how far medical technology has come. Advancements in imaging, diagnostics, and surgical techniques have revolutionized healthcare. But these advancements wouldn't have been possible without meticulous data collection, analysis, and research. The same principle applies to health promotion. By investing in data collection and analysis, we can develop innovative interventions, tailor programs to specific populations, and track our progress with precision. This, in turn, will lead to more effective programs, better health outcomes, and ultimately, a healthier society. As we gather more data and refine our methods, we can develop best practices and establish standards for the field. This will not only enhance the reputation of health promotion, but also attract bright minds to the profession. We need passionate individuals who are driven by data and committed to using evidence to improve population health. We've covered a lot of ground today, but the key takeaway is this. Measuring health is not just about collecting numbers, it's about making informed decisions that improve people's lives. It's about understanding the challenges, planning effective interventions, securing the resources we need, and ultimately, creating a healthier future for everyone. By supporting health promotion initiatives and advocating for data-driven approaches, we can make a real difference. Let's encourage our communities, our leaders, and our healthcare systems to prioritize health measurement. Let's prioritize health measurement to enhance our community's well-being. Together, we can create a world where everyone has the opportunity to live a long, healthy life.